Hello again. I'm Dr. Diana Fite, President of the Texas Medical Association. Thank you for joining us tonight for TMA's Tele-Town Hall on the COVID-19 pandemic's effect on pressing healthcare issues in the border region. This evening's event will be led by Dr. Urrea, Chair of the Border Health Caucus, and Dr. Linda Villarreal, TMA President-elect. Over the next hour, you will hear from several expert presenters, and we hope the information will be helpful to you and your practices. We welcome your participation in tonight's Tele-Town Hall, so please listen for those opportunities. I'll now turn the evening over to Dr. Urrea. Dr. Urrea?
Thank you, Dr. Fite. We're finishing the process of calling more than 5,000 physicians across Texas. This can take several minutes. Over the next hour, you will hear an update about COVID-19 pandemic in Texas and its impacts on the state budget and public health. You will hear information about Paycheck Protection Program opportunities to help your practice operate during this difficult time. You will also hear about how to utilize telemedicine to broaden your capability to care for your patients and about the state of Medicaid funding in Texas. Tonight's speakers joining Dr. Villarreal and me are Eva DeLuna Castro, Fiscal and Budget Policy Program Director for Every Texan, Dr. John Hellerstedt, Commissioner of the Texas Department of State Health Services, Dr. Ogechika Alozie, an infectious disease specialist and member of TMA's COVID-19 Task Force, Mollie Mailman, a TMA practice management consultant, and Dr. Doug Curran, past president of TMA. We also will answer your questions periodically throughout this call, so stay tuned for instructions on how to ask them. And we want your answers to poll questions. We'll tell you how to reply to those when the time comes. TMA has devoted nearly all our resources for the past 14 weeks to COVID-19. We want to help you help your patients and your community as we continue to confront this worldwide pandemic. We understand you face two major threats right now. The very real threat this virus poses to your patients, your practice, your staff, your families, and yourself, and the equally real economic threat this pandemic and stay-home requirements have posed to so many medical practices across Texas. Earlier this year, your TMA Board of Trustees convened a task force on COVID-19. The task force has created frequently asked questions, documents, podcasts, and other guidance to help you and your patients and to help you manage your practice. You can find that information at texmed.org/coronavirus. That's texmed.org/coronavirus. I would like now to introduce my host and co-moderator of this event, Dr. Linda Villarreal, TMA's President-elect. Dr. Villarreal, welcome. We know these are extremely important issues, and we appreciate the speakers joining us for this crucial discussion tonight.
Yes, Dr. Urrea. We knew it was important to convene another TMA Tele-Town Hall meeting to provide more essential information for our fellow doctors, particularly those in our border region of Texas. We hope everyone can benefit by joining us tonight, and we welcome questions. Since TMA is offering continuing medical education for this event, we will ask a question at the end of this call for CME credit. The Texas Medical Association designates this activity for a maximum of 1 AMA PRA Category 1 credit. Physicians should claim only the credit commensurate with the extent of their participation in the activity. The Texas Medical Association is accredited by the Accreditation Council for Continuing Medical Education to provide continuing medical education for all of our physicians. Physicians who remain on this call for at least 53 minutes, put that timer on, 53 minutes, will automatically receive CME credit. You don't have to submit anything or fill out anything. Dr. Urrea, I know you have information our listeners will want to know as well.
Yes. Here's how you can ask our presenters a question or make a comment at any time during this event. Press the 0 key on your phone keypad. A TMA staff member will greet you. Please succinctly tell her your question or comment. Soon, we'll call on you to ask your questions of our experts. Now I'd like to introduce our first speaker, Eva DeLuna Castro. Ms. Castro directs the Fiscal and Budget Policy Program for Every Texan, and she will provide a brief economic update and its potential implications for the next state budget. Ms. Castro, thank you for joining us.
And thank you for having me. I have just a few minutes to touch on a lot of pretty important topics that I can go on for hours about as a state budget analyst, but I'll try and keep it brief and hopefully get a lot of questions from y'all out there about why the economy is affecting the state budget, what that means for health care as an important part of our local economies, and also how it interacts with the state budget. And for those of you who aren't familiar with the group I'm with, it's called Every Texan. It used to be called the Centers for Public Policy Priorities, but we got our roots with the Benedictine Sisters in Boerne, right there near San Antonio. They started off as teachers, branched into healthcare in 1926, operated hospitals and nursing homes until 1985. So even back then, our roots were in education and healthcare and understanding how those work together. So that's what I'll try and connect the dots for here. First of all, as we all know, the shutdown, the shelter-in-place, all of those have pretty much cratered a lot of economic activity in Texas, especially in things like restaurants, hotels, airlines, what we call the hospitality industry. People think of Texas as an oil and gas state, and it clearly is in some regions of the state. But in most places, most economies, what we have is jobs like cashier, waiter, waitress, people who have not been making money for quite a while. We also have state revenue declining significantly. Once the shelter-in-place orders meant that people were unemployed, some of them not getting any unemployment benefits, even with the federal aid we've had. What it means for people to be unemployed is that they don't have as much of a paycheck to spend on anything. Unfortunately, our state revenue system relies extremely heavily on revenue based on consumption. Again, some of you may hear that kind of factoid about 60% of GDP depending on consumer spending. Well, the state budget is very, very much like that. If people don't go out and buy cars and clothing and furniture, potentially 60% of our general revenue budget is depending on that kind of consumer activity. The state controller, where I used to work before I came here, has told us that we've seen historic drop-offs in sales tax revenue, the worst since either the Great Depression, some months maybe even back to like the oil and gas crash of the late 80s. So we're keeping an eye on that, but at this point what we're concerned about is that the budget we're in the middle of may have severe cuts. About 30% of the budget is health care, not just Medicaid, but employer-sponsored insurance for state employees, teachers, all of that. We also have, of course, Medicaid and CHIP. And again, I'll leave it to Q&A. We also have another speaker addressing Medicaid and what it means for the budget. But I'll close on one kind of bright note. Texas is better prepared for a recession at the state level because it has what's called an economic stabilization fund. Today, at this point, it's not future revenue. Today we have $8.5 billion in the rainy day fund, the economic stabilization fund, that could be used to prevent huge cuts to schools and to health care, what we saw about 10 years ago. And again, I'll leave it to some of the Q&A to get at what you can do to help our legislators understand that cutting health care and cutting schools, both of which are a pretty major part of all of our economies, is the wrong way to go, and that it would take years to recover from that and prolong the recession. So what we have right now is trying to figure out how to close out the 2021 budget without severe damage to our state services, and then when the legislature comes back in January of 2021, how they write the next two-year budget, the one that takes us through 2023, again without damaging our healthcare systems and our schools that we need to get the economy going again. So again, I've covered a lot. I know I talk fast. I grew up in the north, but I'll leave a lot hopefully for your questions. Thank you.
Thank you, Ms. Castro. We appreciate you joining us to provide this valuable information, and it certainly is not enough time for you to cover so many issues. And we look forward to seeing how the economy fares for the next legislative session that begins in January. Certainly it's going to be a roller coaster ride. Now it's time for all of you doctors listening in to ask your questions to the panelists. a reminder to do so, please press the 0 key on your phone keypad and briefly tell the TMA staff member your question or comment. Then continue listening to the call in the queue. For those of you not in the queue yet, remember, to ask a question, please press the 0 key on the phone keypad and brief the TMA staff member of your question or comment. Soon we'll call on you to ask your question. Well, while we wait, I think some of us are shy right now. We're waiting for some questions to come in. But Ms. Castro, could you explain to us why education and healthcare seem to take such a big hit during budget crises of the state?
Well, as that old saying goes about the bank robber, that's where the money is. I should also explain that Texas, since I've been analyzing the state budget, about 30 years I've been doing that, we have always ranked in the bottom 5 among states in how much we invest in our public services. The state is very low in state spending. Local governments actually do better, but it's because of how low our taxes are. We rank about 48th in state taxes per capita. So with those scarce dollars that we have, we put about a third of them into the school finance formulas, constitutional requirements to pay for local schools, pre-K through 12, and then roughly another third, as I said, goes to health care. The lion's share of that is Medicaid and CHIP, and we bring down a lot of federal dollars with that. But that's 60% of the budget right there. So it's really hard to deal with a major revenue crisis without eating into those areas, without damaging health and education. But on the bright side, like I said, we do have we have about 10% in reserve funds set aside. So it's not a given that we have to make cuts to schools and healthcare.
Well, thank you. We have here a question from Dr. Godines in Laredo, and her question is on regarding the rainy day fund for emergencies. With the way things are happening with consumption declining, how many months or years will those $8 billion supplement these losses?
That's a good question. As I mentioned, $8.5 billion is already in the state savings account, and then we'll be getting future deposits in because it depends on oil and gas severance taxes. So it's kind of a self-replenishing fund. But what's there today could cover about 7% of our budget, which is pretty sizable compared to what other states. Moody's investors said we're better prepared than about 2/3 of the state. Of the states, I mean, and then the other issue is that we have gotten already some federal relief funds that will help us protect Medicaid from cuts, from benefit or eligibility cuts. We've got what's called a better FMAP, a match rate for Medicaid. So we have both state money coming in that they already put away for a rainy day. We have federal money that's helping prop up the budget, some money for education as well. So I would say about 13%. I'm not used to thinking about it in months or years, but it's a good reserve to have.
Well, but I mean, considering the worst case process, coronavirus doing the worst thing to the rest of the state, it'll be in common sense terms. It's like saying how much do I have in savings and how many months or how many years will, if I don't have a job, can that take me to, or can I keep the office open? That's why I was asking. I mean, you gave us a percentage, 7%, 13%, but how long can it, worst case situations, the business have to be shut down. How long will that, I mean, we're in a better position than other states, but would that help us for 2 more years, for 1 more year? What is your best estimate? I know it's an estimate.
Our kind of what we're message to legislators. Sorry, I'm trying to get the right words here. Our message to legislators is that using the entire economic stabilization fund in this coming session, assuming a worst case scenario, and it's hard to tell these days with today's reports of how many COVID-19 cases are being reported. Anyways, if they use the economic stabilization fund to close out 2021. The controller will give the legislature a forecast for what happens in the next 2 years, and then at that point they can also use it's not just the money set aside, but they have a lot of like financial mechanisms that they can use, speeding up revenue collections, postponing big payments. I mean, this gets into the kind of the wonky parts of the state budget and how it works. But they have a lot of other tools that they've used. In 2011, they closed a $27 billion shortfall, roughly half with these kind of smoke and mirrors and half with cuts. We don't want to see that happening again, but there are alternatives to cuts is the point I'm trying to make. The rainy day fund is one of those tools.
All right, let's try to hit one more question. And Dr. Fierros from San Antonio, could you please ask your question?
Hi, yes, this is Dr. Fierros. I'm a psychiatrist, and I practice in San Antonio. I'm in private practice, and I take insurance. And I've been able to continue practicing because of telehealth. I'm really, really happy about the extension of telehealth. Although I'll tell you, before COVID, I was not a big fan of telehealth, but now I really am. One of the problems that we're having is that we have to justify telehealth to the insurer, like why we decided to do telehealth. And so I was wondering, this is a quite administratively burdensome task because we have to go back and look at every individual note and see why it was appropriate for that patient. Now, in the era of COVID, I don't think this is going to be a problem, but in the future, if telehealth continues, I just wondered if there's any plan to create modifiers that would explain why it was necessary to use telehealth with patients. For example, we use 95 for the telehealth modifier, but perhaps you could use 95 and then different modifiers of 1, 2, 3, 4, 5, depending on what situations we think make telehealth necessary for this patient, just so that using telehealth is something that is not more administratively burdensome than not using telehealth. And that's my question.
Dr. Alozie, will you help us with that?
Yeah, definitely. So I think that's an excellent question. And like you said, the era of COVID has brought immense change to the healthcare landscape. I think it's really too early to have a conversation about what's going to happen. What I can tell you is that the Texas Medical Association continues to strongly advocate for payment parity to remain beyond the COVID-19 emergency. I think CMS Administrator Seema Verma, in an interview approximately 2 weeks ago, said that the cat was out of the bag and we weren't going backwards. Now, where that plays out a year from now is going to be very different. But I think what's important is that we can do it now. TMA and a host of other organizations are going to continue to advocate for this to be the new health care. And so it's no longer called telemedicine, it's just medicine. And so I think that's really where the future lies.
Well, thank you, Dr. Alozie, and thank you for the great questions, everyone. We'll provide another opportunity to ask more questions a bit later in this call. But first, Dr. Villarreal, do you have our first poll question?
Yes, I do. Here's the first question we want everyone to answer using your phone keypad. About which of the following would you need more information or concerns you most? Press 1 on your phone keypad if you would like more information on contact tracing plans and how to connect with your patients. Press 2 if you want information on how to better comply with reporting requirements for physicians regarding COVID-19. Press 3 if you have trouble accessing rapid point-of-care tests for COVID-19 and or the personal protective equipment you need to safely practice. Press 4 if you are concerned about rising COVID-19 cases and hospitalizations and would like stronger messaging calling for social distancing, masking, and other community mitigation measures, or press 5 for more than one of the above. Once again, about which of the following are you most concerned or do you need more information? Press 1 if you would like more information on contact tracing plans. Press 2 if you need more information on better complying with COVID-19 reporting requirements. Press 3 if you have trouble accessing rapid point-of-care tests or PPE. Press 4 if you are concerned about the rising number of COVID-19 cases and would like stronger safety messaging, or press 5 for more than one of the above. We will tabulate and report the results soon. I would now like to introduce our next speaker, Dr. John Hellerstedt, Commissioner for the Texas Department of State Health Services. Dr. Hellerstedt will discuss COVID-19 trends, testing, and reporting. Dr. Hellerstedt, thank you so much for joining us this evening.
Good evening. This is John Hellerstedt, the Commissioner for the Texas Department of State Health Services. Am I coming through loud and clear?
Perfect.
Yes, you are, sir.
All right, very good. So thank you for inviting me to the town hall. I really appreciate this opportunity to address the caucus personally, and I want to thank the folks out there in the front lines. As far as our statewide response to COVID-19, really the Department of State Health Services began taking action to fight the SARS-CoV-2 shortly after the CDC announced the first confirmed case in the U.S. In January of this year. Well, there's been a wide range of responses that we at DSHS have worked in conjunction with the Texas Department of Emergency Management. A lot of the supplies and PPE flows through that system, so we've had a role in acquiring those things, in inventory management, the supplies, planning for or creating alternative care sites, deploying rapid response teams, and of course a lot to do with managing our public health laboratories, obtaining reagent for them and that sort of thing, especially in the beginning, the deployment of PPE and medications, which was very, very difficult at first, and the creation of information systems, especially for contact tracing. We have been active on social media. We have campaigns that deal with Texas DSHS on Facebook, Twitter, YouTube, and Instagram, and trying to engage the public and engendering their trust. And of course, at the point where we are now, it's very important to get the message out there about the preventive measures we want people to take. We've invested in an extensive Spanish language campaign based on market research with the Hispanic Texans to ensure that we have really culturally competent communication. And some of you might have seen our Quédate en casa. I hope I got the Spanish quote close enough. So basically, stay at home kind of message. And we have translated all of our reopening safety protocols into Spanish as well, and those are on our website, which is www.dshs.texas/coronavirus. By January 31st, we had activated the State Medical Operations Center and began activating the Regional Medical Operations Center on February 17th. I want to talk a little bit about the statistics so far. On March 4th, that was when Texas had its first COVID positive patient. It's hard to believe that was so short a time ago, really. And the first death was on March 17th. And since that, in only a span of 110 days, the number of confirmed cases has grown to more than 119,000, and the number of deaths to over 2,206. The number of people hospitalized with COVID in our state now stands at close to a record high of around 4,100. And without quarantines and some of the actions that were taken earlier, there's no doubt that we would not have flattened the curve and that the numbers would be even exponentially worse. Our healthcare system capacity could have been overwhelmed if we had not taken that action, and we did not want to be in a situation, and I know you wouldn't either, where people didn't have room in the hospitals when they needed it. That bought us some time for the resupply of personal protective equipment, of PPE, to come up from various sources. It's allowed the hospitals to be able to plan for surge capacity, and we hopefully will buy enough time and manage COVID to the point where we will have some definitive treatment and or vaccine. Throughout this pandemic, the state and local leadership have been asking for data about the spread of the virus into the communities and for information on how it's impacting different groups of people. This data is very important, and I really want to emphasize that physicians have a big role in that. So if you're ordering tests for COVID-19, please supply as much of the information as is asked for, particularly the demographic information. We want to make sure that we capture things like ethnicity and race in particular. I want to talk a little bit about the border and COVID-19. We do track surveillance trends in all the counties, especially in the border. We have seen over the past weeks, especially, an incidence of new cases surging in the border counties. They're surging in the lower Rio Grande Valley as well as in El Paso. But again, just got off a call with hospital executives from around the state, and they're prepared to surge up to meet that demand. Although it's definitely something that we're watching very, very closely. We're following our existing protocols for communication with Mexico regarding surveillance and epidemiologic information of joint interest. And we know that COVID-19 is present in all the Mexican states, including those along the Texas-Mexico border. I don't think I need to preach too much to this group about prevention, and that's really the bottom line. We can do testing, but by itself, testing doesn't really prevent a case of COVID-19. We can do contact tracing. That hopefully will, as it becomes more robust, that will in fact allow people who have been exposed to or are confirmed to isolate and therefore prevent it. But until a vaccine is available, everyone is at risk. One of the things that occurred was we were relatively successful in meeting the first onslaught of COVID-19. And so after that phase, we began opening up. It was necessary to open up the economy. As was referenced earlier in the talk about the economics, people were out of jobs, and the economy is not just about wealth, if you will. The economy is about providing the goods and services that everybody needs and allowing people to be employed and be able to support their families and pay their bills. So it was necessary to open up, but we've definitely seen and knew we would see that there would be some increase in COVID-19 as a result of that. So again, I don't want to belabor the messages that I'm sure are out there and you're very well aware of. We really still want people, if they can, to maintain social distancing, especially vulnerable populations. Hand washing is great, cloth face coverings in public, and limiting the number of people that you come in contact with. I think one thing that deserves a lot of emphasis is we're really seeing that people with very mild symptoms, some people just really have very mild symptoms with COVID-19, but they're still contagious. And so even people with very mild symptoms should be taken seriously. We know that you as physicians play a huge role in protecting our most vulnerable high-risk populations. So please talk to your patients who are older than 65 and those with underlying health conditions and advise them best on how to remain isolated if they can and avoid getting infected. Again, I'll mention our website, which is dshs.texas.gov/coronavirus. We have great information there, particularly the statistics that on all of the counties in Texas, and you can see your regions and see guidelines, resources, and protocols there. And one thing I think also to keep in mind is that COVID-19 is occupying a lot of our time, but there are still lots of other public health things that we need to be doing every day, and we are doing every day here across Texas. As you know, we're a home rule state, so wherever there's a city or county local health department, they have that jurisdiction. But we work closely with our colleagues around the state. And what we're concerned about, too, is that we want people to come in for their preventive health care. And as a pediatrician, I'm thinking particularly about kids making sure they get their vaccinations. And we're looking forward to the fall flu season and urging people to get those. So I'll conclude, and thanks again for your service to the state and all that you've been doing to keep Texans healthy and safe through these tough times. Thanks.
Thank you, Dr. Hellerstedt, for sharing such important information with our physicians. For our first poll question, we asked about your public health concerns or what information you need. 7% of you say you would like more information on contact tracing plans and connecting your patients. 8% would like information how to better comply with COVID-19 reporting requirements. 18% report that you have trouble accessing rapid point care test or PPE. 52% are concerned about rising number of COVID cases. and would like stronger safety messaging. And 46% say more than one of the above is important to them. Now it's time for everybody to ask more questions of our panelists. A reminder, to get in the queue to ask a question or make a comment, just push 0 on your phone. A TMA staff member will take your name and your question and place you in the queue. We have a few people waiting in the queue. Thank you for your patience. Our first caller is Dr. Slayman from Houston, Texas. Would you please ask your question, sir?
Yes, hi, this is Dr. Slayman. I'm an internist, family practitioner here in Houston. And my question is, if you, as a physician, and this is the case with me, and it's fine with me to say that, I tested positive for COVID-19. I'm completely asymptomatic, and I did fine with it. When can I go back to work?
Dr. Hellerstedt?
Yes, I'd refer you to guidance either from our website or from CDC. It really kind of depends on how you want to do it. I mean, if you can stay, if you're asymptomatic and you can stay for the entire time, wait out the convalescent period, and then go back to work, you can do it that way. Otherwise, for folks who are in really kind of critical places, if they're asymptomatic, well, I'm really kind of thinking of contacts here, but you know, you should really stay home until your period of convalescence isolation.
Which is 14 days, right?
14 days, right?
Yeah, and this is exactly what I'm doing. I'm gonna weigh out the 14 days. But do I need to present my employees with a negative test? This is the question.
Not if you have waited out the 14 days and you're free of symptoms.
That's what I thought. Thank you. You answered my question.
Thank you. Our next caller is Dr. Fierros from San Antonio, who has a question about the flu vaccine.
Hi, yes. This actually was something that the previous speaker sort of reminded me of. I've been hearing a lot, remember I'm a psychiatrist, but I've been hearing a lot about people being afraid to get the flu vaccination because there's some sort of belief that if they get it, it makes them more susceptible to a worse case of COVID. And so I just wondered, like, is there an educational campaign happening? Because I feel like there's a lot of conspiracy theories and people not trusting us with vaccinations. And I just wondered, is anyone going to try to address this?
Well, in general, we have campaigns that support influenza vaccine every year. I think looking at that, if there's a rumor out there that it somehow makes people more susceptible to COVID, maybe that can be part of our message going forward. But I hadn't really heard that people were making that connection. But as you know, I mean, there's a lot of vaccine doubters out there. And it's a big problem that we all need to take some steps to address, both in public health and in practice.
Well, thank you. Once again, wonderful, insightful questions. It's helpful to hear what's on physician minds responding to this disease. We'll have one final question and answer segment later on this call. Please be ready with your questions and press 0 to get in the queue. Dr. Villarreal, I know we have our second poll question for our doctors.
Absolutely. Yes, sir. As we move on to telemedicine, here is your second poll question of the evening. We know more physicians and their patients are using telemedicine now, but obstacles remain. We'd like to try and learn what some of those obstacles are. So here is the question. How many of your patients are able to connect to a telemedicine visit without any technical support? Press 1 on your phone keypad if the answer is 25% or less. Press 2 on your phone keypad if the answer is between 25 and 50%. Press 3 on your phone keypad if the answer is 50 to 75%. And press 4 on your phone if the answer is greater than 75%. Once again, let me repeat. How many of your patients are able to connect to a telemedicine visit without any technical support? Press 1 if it's less than 1/4 of your patients. Press 2 if it's between 1/4 and 1/2 of your patients. Press 3 if it's between half and 3/4 of your patients. Press 4 if more than 3/4 of your patients can do a telemedicine visit with no technical help. We will share the answers in a bit.
Thank you, Linda. Now I'd like to introduce our next speaker, Dr. Ogechika Alozie, an infectious disease specialist here in the great city of El Paso, who's also a member of TMA's COVID-19 Task Force. Dr. Alozie joins us to talk about utilizing telemedicine to care for patients. Dr. Alozie, thank you very much for joining us.
Thank you very much for having me, and thank you to everybody that's online. So part of my background, besides being an infectious disease physician, is I was the co-chair of the TMA's Ad Hoc Committee on Health Information Technology. And approximately a year or so ago, we asked multiple members of TMA in our biannual polling, we said, hey, which of you are using telemedicine? Because part of our purview was to go to the state and say, this is something that we believe is important. At that point in time, it was approximately 10 to 12%, a really low percentage. And as somebody that was a former chief medical informatics officer, I actually had some chagrin about that. In a previous town hall that we had in the same platform about a month and a half ago, about 74% of the 2,000 physicians that were on the call indicated that they had implemented telemedicine since March 1st. That's an astounding change in percentage, and it's all driven by coronavirus. All the barriers, all the challenges, and when I say all, it's a little bit of hyperbole, but a lot of those barriers and challenges that we were presented with as a physician community, literally in a week in March, disappeared. When first Governor Abbott said that the restrictions around telemedicine and payment parity would be waived, and then I think within a day or two, CMS, the Administrator Verma, said the same thing. I think it's really important for physicians to understand that in as much as they're using telemedicine, there's a host of things that can be done with it. Right? I know people are using it for psychiatric visits, for telemedicine visits, for wound care. I think it's important that whatever tool you're using, that your receptionists and call screeners have an understanding of what's your process. How do you onboard people? How do you ensure that people that are within your clinic know how to get onto the platform? Are you calling them ahead of time? I think all of these things are really important. And it's not just for visits. Like I said, depression and mental health, domestic, interpersonal violence, substance abuse, alcohol screening. I've seen my surgical colleagues and OB colleagues do it for pre- and post-operative evaluations of wounds and being able to use the patient's own camera in their house to look at the wounds and assess the progress. And of course, medication refills, and that was being used actually as a primary point for telemedicine even before that. There's a host of waivers that have also come into place that allow you to use non-HIPAA compliant platforms. I always tell people with this, if you can find a platform that's HIPAA compliant, all the better. But if for emergency reasons you need to use Zoom or Skype or FaceTime, for now that may be appropriate, but I think as we're into June and actually going into July, it's really important to sort of think about what's my long-term option? Am I going to use this for the rest of the year, for another month or two? I think if you found a niche or a business use case in your clinic or your organization where telemedicine not only is playing a role now, but will play a role going forward, I think it's really important for you to determine in your organization what's our long-term option, right? Which organization or which company are we going to use to do our telehealth and kind of really figure out what the contract and payments around that is. There's a host of waivers I sort of alluded to before, including audio-only exams and in-person exams and still get paid. Payment parity primarily applies to Medicare, Medicaid, and state-regulated plans. ERISA or self-funded plans, and those are about 43% of Texas insurance market are actually not subject to parity rules, and so be careful about that. Really understand what is the payer that you're using and what are their rules. And like I said before, TMA will continue to strongly advocate that we need payment parity, not just for COVID-19, but like I said, changing telemedicine to medicine. And I think that's really the future of healthcare going forward. There's a host of restrictions that have been waived around seeing the patients in their own home. Again, if you're conducting a telemedicine visit from your home, you haven't felt comfortable going into your office, you should still have the billing address listed as your office address, because that's where the care took place. And again, think about as you sort of expand your telemedicine or become more comfortable with it, Do you have a dress code for your staff, for yourself, for your team? Do you have a background that should be standardized, right? How are your greeters and your front desk staff being involved in onboarding that patient that may have an issue? And I think it's really important that you have that sort of operationalized and go from there. I think, again, not the most important thing, but one of the important things is that TMA has a host of resources. We've been thinking about this for a long time. The times are changing rapidly and will continue to adjust. If you go to texmed.org/telemedicine, you'll see a host of policies, procedures, vendor selection tools. And again, TMA also has a practice viability resource where you can as you reopen your practices and really trying to figure out what is my road to recovery. And there's specifically a document there that I think can be very helpful. For those of you who have been scared of technology or haven't embraced it, I think this is the time to embrace it in a sort of, in a sense, no holds barred, but also no penalty period, where you can really learn how to use telemedicine to enhance your practice, not just in this pandemic, but going forward. And with that, thank you very much.
Thank you, Dr. Alozie. Telemedicine is indeed a useful tool for ensuring our patients have access to the care they need, especially during COVID, and COVID has been an accelerator to what telemedicine will become for the future. Dr. Villarreal, do you have the results for the second poll question?
I sure do, Dr. Urrea. Thank you. We asked our physicians how many of your patients are able to connect to a telemedicine visit without any technical support. Looking at the graph and the results, we have 36% of you said less than 1/4 of your patients are able to connect to a telemedicine visit with no technical help. Sounds like me. 28% of you said between 1/4 and 1/2 of your patients were able to do a telemedicine visit without any technical support. 21% of you said between 1/2 and 3/4 of your patients, and 16% of you said more than 3/4 of your patients can do a telemedicine visit with no technical support. So as you can hear, it is pretty much almost an equally spaced out distributed pie chart. So it's kind of all over, and part of that may actually be a geographical or the social determinants that impede this.
Well, thank you, Dr. Villarreal. Those insights will be helpful for working with our patients as they use the technology of telemedicine. Now I'd like to introduce our next speaker, Mollie Mailman, a staff practice management consultant with TMA. Mollie joins us to talk about opportunities surrounding the Paycheck Protection Program during this pandemic. Mollie, thank you very much for joining us.
Good evening. Thank you for having me. Again, my name is Mollie Mailman, and I'm a practice management consultant here at TMA. For the last several months, an overwhelming majority of practices have seen a decrease in production due to COVID-19. This directly and negatively affects the practice's bottom line and financial well-being. TMA recently conducted a survey and found 64% of physician respondents reported applying for an SBA loan to address cash flow issues. Of those 64 physicians, an overwhelming 95% said they applied for the Paycheck Protection Program. So let's dive into the details of this program and some of the new updates regarding the Flexibility Act that was just passed. So under previous PPP loan guidance, borrowers had 8 weeks from the time they received the first loan installment to spend the funds. With the Flexibility Act, this lets borrowers extend the period to 24 weeks, but not beyond December 31st of 2020. Under the new timeline, full forgiveness is still possible. The loan repayment period has been extended to 5 years from the original 2, while retaining the original 1% interest rate. This gives borrowers more time to pay off the unforgiven portion of their loan. The payment deferment period on items such as principal, interest, and fees are now extended from 6 months to the date the borrower is told the amount of their loan forgiveness. Additionally, the original guidelines mandated that 75% of any forgiven amount had to be spent on payroll costs. The Flexibility Act reduces required payroll expenditures to 60% of the loan amount, with up to 40% of the loan amount being used for mortgage, interest, rent, utility payments, while still retaining full forgiveness of that amount. This change reflects complaints from many businesses that their payroll costs went down as employees were laid off, but fixed costs like rent did not change. Now, regarding the changes to loan forgiveness, failure to spend at least 60% of the total loan amount on payroll will result in no loan forgiveness. Previous requirements required spending 75% of the forgiven amount on payroll. Borrowers can now use this 24-week period to restore their workforce to pre-COVID levels to obtain the full forgiveness. Now, if you already have the 8-week period, you need to contact your lender if you'd like to extend to 24. It's not automatic. You have to reach out to your lender for that process. The new deadline to achieve this is December 31st versus the previous deadline of June 30th. 2 new exceptions let borrowers achieve full forgiveness even if they do not fully restore their workforce. These are in addition to previous guidance that let companies exclude workers who turn down good faith offers of reemployment. Borrowers can now also reduce workforce requirements based on the inability to find qualified employees or if they were unable to restore operations to February 15, 2020 due to COVID-19 restrictions. Failure to apply for loan forgiveness within 10 months of the end of the covered period will result in payments being due. Finally, the PPP Flexibility Act lets businesses that took a PPP loan also delay paying their payroll taxes. This was not allowed under the original CARES Act. If anyone has additional questions, please contact the TMA Knowledge Center at 1-800-880-7955. Thank you for your time.
Thank you, Mollie. That was a great amount of information, and we appreciate your counsel. Now, our next poll question for everyone to answer pertains to Medicaid. Texas lawmakers may consider cutting Medicaid physician and provider payment in 2021, which is only 6 months away. This to be done to help close a budget shortfall. If lawmakers were to cut Medicaid physician payments by 2.5 to 5%, how would this impact your Medicaid participation? Press 1 on your keypad if you would continue to accept all new Medicaid patients. Press 2 on your keypad if you would accept new patients but with limits. Press 3 on your keypad if you would stop accepting all new Medicaid patients but continue to see existing Medicaid patients. Press 4 on your keypad if you would discontinue participating in Medicaid, or press 5 on your keypad if you would close your practice. Again, very important. Press 1 on your keypad if you would continue to accept all new Medicaid patients. Press 2 on your keypad if you would accept new patients but with limits. Press 3 on your keypad if you would stop accepting all new Medicaid patients but continue seeing existing Medicaid patients. Press 4 on your keypad if you would discontinue participating in Medicaid, or press 5 on your keypad if you would close your practice. I would like to introduce our next speaker. I am very proud to say Dr. Doug Curran is a close friend, a family medicine physician, and past president of the TMA. Dr. Curran joins us to talk about Medicaid funding in Texas. Doug, thank you for joining us this evening.
Well, thanks, Linda. Thanks for the kind remarks. It's always good to be with folks in the border area. Have a special place in my heart. I think we see in rural Texas and folks in your area have a lot of things in common. Well, I don't need to talk to you all about the importance of Medicaid and Children's Health Insurance Program. You live it every day. You know that 4 million Texans, 80% of whom are under age 21, need this service and need this opportunity to get health care. An estimated 25% of Texas Medicaid and CHIP enrollees live along the border, and they make the programs vital to the region's ability to address health inequities and to deal with all of the issues regarding morbidity and mortality, infant care and child care, immunizations, all the things that need to be done to help us protect Texans. At the outset of the pandemic, both the state and federal government adopted important Medicaid protections and flexibilities to help patients and physicians better weather the emergency. Tonight, I will highlight some of those, and in addition, I would encourage you to look at the TMA's website at www.texmed.org/coronavirus, and it'll give you some of this information in some additional detail. Well, in March, Congress adopted the Federal Families First Corona Protection Act, which has been a part of assisting us in managing Medicaid. It prohibits states from reducing Medicaid eligibility through public health until the public health emergency has finished. And in exchange for that, it's given the states an additional 6.2 in Medicaid funding, 6.2% Medicaid funding for each state. Additionally, the law requires states to maintain coverage for anyone enrolled in Medicaid after March 18th of 2020 through the end of the public health emergency. And as a result, that allows pregnant women and others who would have lost their Medicaid in 2 months postpartum or in a month, or if they didn't keep up all of their income checks and other things, then they would have lost all that, and they're not going to do that at least until the end of June. And we're going to, from TMA, reach out to others and try to extend that for another 3 months. Texas also enacted new Medicaid telemedicine flexibility, and you've heard some conversation about some of the telemedicine opportunities that are out there for us. And, we've seen in our area a lot of difficulty in dealing with telemedicine when it comes to seniors and doing anything other than audio calls. And we struggle some with that in dealing with them, but there's opportunity there. And as already mentioned, TMA is going to continue to work hard. We have telemedicine in place until the end of June with parity payment, and we're asking for another 3 months, and we've got to get this fixed so that we get parity as we move forward, because it's going to be part of how we take care of people. The Center for Medicare and Medicaid Services recently announced the creation of the long-awaited Medicaid and CHIP Provider Relief Fund to help Medicaid-heavy practices that did not receive funding from previous CMS relief maneuvers to have an opportunity to get that. There's about $15 billion that will be available to eligible physicians and providers, amounting to at least 2% of the annual gross for eligible practices. To qualify, physicians must agree to some CMS terms, and this includes things like direct billing with Medicaid, Medicare, that you had to be doing that during the time between January of 2018 and December 31st of 2019. You must have provided care for Medicaid patients after January 31 of 2020, and you must have you must not have permanently ceased operations, and you must not have received other payment from CMS general distribution funds. Throughout the pandemic, TMA has vigorously pursued federal and state Medicaid legislative support and relief to protect physicians and patients, including advocating that Congress allocate additional Medicaid dollars to the states in order to prevent them from cutting benefits, services, and payment that's already woefully inadequate. Our advocacy efforts will continue to call for increasing Medicaid payment to physicians and accomplishing Medicare parity if at all possible. And we got to do everything we can to stop the silly paperwork and the red tape and the horrible provider application. We're just starting a federally qualified health center for our new family medicine residency, and I've been trying to get the physicians that are working that already have contracts and agreements with Medicaid, but getting our facility in has been a nightmare. They called today and wanted my license, my driver's license, as one of the providers. It just is something else every day, anything to delay payment. We're going to work as hard as we can to stop this. Protecting Medicaid from any funding cuts will remain one of TMA's highest priorities during the next session. Thanks for the opportunity to visit with you, and I'll be glad to answer any questions I can about Medicaid, and hopefully we can keep everything going in such a way that we can continue to care for this populace that's going to increase in size and going to have tremendous need during this time of pandemic and resolution of the pandemic. Thank you.
Thank you, Dr. Curran, for sharing your thoughts with us. You've been an incredible advocate for children and the border and all of us Texans who practice here. We certainly all agree Medicaid funding is very important to Texans, especially those on the border. Now is your final opportunity to ask your questions of our panelists. To do so, just push 0 on your phone. A TMA staff member will record your name and question and place you in the queue. The first question to Dr. Curran is, how should Texas physicians, those here on our phone call, best advocate to protect Medicaid and CHIP from potential budget cuts in 2021?
Yeah. Well, that's a great question, and I really think an important question. We need to begin have conversations with our legislators right now. We have to start talking about the challenges that are going to be out there. We're going to see a huge percentage of our populace begin to move into this category of payment because they're going to lose their health insurance, and they're going to lose jobs, and they're not going to have the resources nor the income to manage any of this. So this is all coming, and we've got to prepare our legislators now. If you're not talking to your legislator, if you don't know who your legislator is, if you don't have a relationship with them where you can pick up the phone and call them and have a cup of coffee, get one. It's time to move out there. It's time to build relationships. It's time to get them in the game. I called both our senator and our representative today because I'm sick and tired of this nonsense and the harassment I'm getting over getting our facility credential. And it's been going on for the better part of 6 months. And so I think it's time to share our frustrations. It's time to talk to our elected officials. It's time for us to expect that they step up and help us take care of our patients. We've been hamstrung enough and being really hamstrung through Medicaid because of a lack of payment and all the hassles that are out there. So we need to share that so we can stop this from happening.
Thank you. Without a doubt, we need to advocate for our patients, and we need to talk with all our local politicians and start the process or continue the process we've been working on. A second question we have here is, for the big administrative hassle with children who lose Medicaid coverage because their parents miss one of their many income checks, what is TMA doing to remedy this problem, and what can physicians here on the border do to help with this solution?
Well, I think we have to get a longer period of time after you sign up for Medicaid. We need to be sure that our patients are staying on for at least a year or longer. We cannot have them moving back and forth. It really harms our ability to deliver the kind of care we need to deliver. And I think we've got to we've got to really begin to move out to and explain to our patients the importance of being sure that they're getting in for their care and that they're coming in this time of pandemic. We've seen a lot of people that are not getting their well child care, and we're in fact, one of my frustrations with our clinic that we're running is that we can't give immunizations right now and get paid for them. So we've got a number of children that are waiting for it. We've got to be sure that our people understand the significance of getting appropriate care and tending to things in such a way that we can get them cared for and keep them well and healthy, so they're working, producing, building the economy back to what Texas needs to be.
Thank you very much for those great questions, and Dr. Curran for your answers and motivating us. We're sorry we're out of time for questions, and there's still people waiting. If you weren't able to ask your question, please email TMA at knowledge@texmed.org, knowledge@texmed.org, and TMA staff will reply as soon as possible. Dr. Villarreal, do you have answers to the Medicaid poll question for us?
We asked our physicians if lawmakers were to cut Medicaid physician payments by 2.5 to 5%, how would this impact your Medicaid participation? The results are actually quite interesting. 24% would continue to accept all new Medicaid patients. Those that would accept new patients, but with certain limits, 25%. Those that would stop all new Medicaid patients but continue seeing their existing patients, 25%. Those that would discontinue participating in Medicaid completely, 21%. There is a very small slice of the pie at 5%, thank you, physicians of Texas, that would close their practice. So overall, it is quite equally dispersed. We must continue, as Dr. Duran said, to advocate for our patients through our legislative advocacy. I now need to ask you that magical 53-minute in the call question for your CME evaluation question. Which step will you take as a result of participating in this Tele-Town Hall event? Press 1 if you will apply new public health knowledge or practices in response to COVID-19. Press 2 if you will use information learned to modify any business element of your practice. Press 3 if you will implement telemedicine in your practice. Press 4 if you will do more than one of the above, or press 5 if you will do none of the above. Once again, which step will you take as a result of participating in the Tele-Town Hall event? Press 1 if you will apply new public health knowledge or practices in response to COVID-19. Press 2 if you will use information learned to modify any business element of your practice. Press 3 if you will implement telemedicine in your practice. Press 4 if you will do more than one of the above. Press 5 if you will do none of the above.
Thank you, Linda. We're nearing the end of our program for tonight. On behalf of TMA's Border Health Caucus, I thank you for participating in tonight's Tele-Town Hall event. We hope you found the information helpful, and we hope to see you at one of our upcoming regional Tele-Town Hall events. Again, if you are not able to ask a question of our panelists tonight, but wanted to, please email TMA anytime at knowledge@texmed.org. That's knowledge@texmed.org, and the TMA staff will reply in the coming days. Dr. Villarreal, I'll turn it back to you to close tonight's TMA COVID-19 Tele-Town Hall meeting.
Thank you so very much, Louis. We want to thank everyone who joined us this evening. We hope this TMA and Border Health Caucus service has been beneficial to you. Our goal is to help you respond to this serious public health threat and to empower you to keep your medical practice viable now and in the future. I want to give special thanks to our speakers this evening, Eva DeLuna Castro, Dr. John Hellerstedt, Dr. Ogechika Alozie, Mollie Mailman, and Dr. Doug Curran. I also want to thank my co-moderator for the event, TMA's Border Health Caucus Chair, Dr. Urrea, and our host, TMA President, Dr. Diana Fite. Physicians who remained on the call for at least 53 minutes will automatically receive CME credit. You do not need to do anything to receive this credit. Again, we have your number and a log of how long everyone stayed on the call. So if you listen for at least 53 minutes, you will receive CME credit. For more information about this evolving situation, please visit TMA's COVID-19 webpage at texmed.org/coronavirus. Once again, I am Dr. Linda Villarreal, your TMA President-elect. Thank you again for joining TMA's Tele-Town Hall on healthcare issues in the border region. Good night. Thank you.
TMA and the Border Health Caucus thank TMLT, the Texas Medical Liability Trust, for its generous support of this event.